Let's get the focus back on the COVID pandemic now. This is yet another alarming sign because this is an alarm that has now been raised by scientists saying that there is evidence that this coronavirus is airborne as well. They have called for the WHO, the World Health Organization, to revise recommendations. Remember, WHO several times in the past has said that this is a droplet infection. It is not airborne, but this is an upgraded alarm that we're now getting to hear from the scientists. The possibility here of this strongly feeling here that this is airborne makes it all the more contagious. In an open letter here to the WHO, massive number of scientists, 239 across 32 countries, have outlined what they think is evidence showing how smaller particles can infect people and that people might have to use masks while they're indoors as well. Social distancing settings to follow indoors as well. Just a week ago, which was on the 29th of June, the WHO has stated evidence of the virus being airborne is not convincing and the research is inconclusive. So once again, in just a week later, you have this whole number of scientists urging the WHO to relook into that. As far as India is concerned, in response to this is concerned, the Director General of the CSIR, which is our Council of Scientific and Industrial Research, Dr. Shekhar, has spoken to Mirror Now on this very issue, on the concern raised. The CSIR chief has agreed to the fact that the droplets do stay in air for some time. And that's why mask has become very important. However, he also added that these droplets settle down soon and they can't travel any further, unlike if something is airborne.
Coronavirus is transmitted through aerosols, and people who are not infected, when they are breathing in and breathing out, at that time through these aerosols the virus gets into our body. But there is no need for concern because these aerosols don't travel once a very long distance. Number two, they don't remain suspended in air for a very long time. So therefore, there is no need to panic for any person about the aerosols. It's only important to maintain social distance. So as long as the infected person and a non-infected person have maintained a distance of about 6 to 8 feet, the uninfected person, the probability of getting those aerosols from the infected person is very low. And that's essentially what the scientists have written to WHO to reconsider as aerosol as the primary route of infection.
Our correspondent Ayushman is getting us further details here on that. Ayushman, this is on an assuring note as far as our CSIR director is concerned, that the only reason that there is a sense that this could be airborne is that it continues to be carried in very, very tiny droplets as well. But is it still to be questioned because we are looking at a very large number, 239 scientists from across 32 countries that have written to the WHO, urging the WHO to have a relook on this?
In fact, sir, ever since the coronavirus pandemic we have seen the outbreak, from that point only, questions have been raised over the role of WHO all across the world. Now, this discussion that we are having right now is not new. It has been there in the public domain for a long time, but this is a new turn into all of that. The fact that coronavirus can travel in the airspace, it is airborne, was there in the public domain, but a new claim by the scientists from 32 different countries have given it a new twist. Today at 8:30 p.m., the World Health Organization will be addressing a press conference. It will be important to see if they address this point also. But sir, if you see right now, the CSIR DG whom we spoke to, he also agreed to the fact that for some time in the suspended form, the airborne disease, like we see the transmission, that does not happen. But definitely the droplets which an infected person when sneezes or he coughs, that you can clearly see that happens here. But he clearly said that there is no traveling mode there. So the droplets don't travel and they settle down. But then he also points out that it is very important to understand that the role of mask becomes important, and the closed chamber which we are talking about, the work from home concept that we are talking about, that becomes essential and social distancing becomes essential. Sir, if you remember, in the month of January, WHO said that there was no human-to-human transmission possible of COVID. Later, they changed the guideline. Now there is again a claim that says that it is airborne. It will be important to see if WHO changes its stance on airborne, because so far WHO has said that coronavirus is not an airborne disease.
That's right, Ayushman, and if at all that happens, it would entirely change the approach to the virus as well. Ayushman, thank you for getting us those inputs.